Welcome to the Health Workforce Technical Assistance Center's webinar series. This presentation is entitled Entry and Exit of Workers in Long-Term Care, and it was presented by Bianca Frogner and Joanne Spetz on May 20th, 2015. But before we get started, I would like to introduce you to today's speakers. Dr. Bianca Frogner is an associate professor in the Department of Family Medicine at the University of Washington's School of Medicine. She is also the director of the UW Center for Health Workforce Studies, a HRSA-funded center that focuses on the allied health professions. Bianca is a health economist who has published several works in the areas of health insurance, healthcare delivery systems, and welfare reform. Dr. Joanne Spetz is a professor at the Institute for Health Policy Studies in the Department of Family and Community Medicine and the School of Nursing at the University of California, San Francisco. She is the Associate Director for Research Strategy at the San Francisco Center for Health Professions and the Director of the San Francisco Health Workforce Research Center. Her field is especially on labor economics, public finance, and econometrics, and teaches in the areas of quantitative research methods, healthcare financial management, and health economics. At this point in time, I will turn the event over to our presenters.
Great. Thank you so much, David. I hope everyone can hear me okay. But thank you for having us share our work. And I'm glad to see that that many of you have joined today to hear about the findings that Joanne Spetz and I have done on looking at the long-term care workforce. Joanne is on the phone today too, and but she'll be chiming in kind of as necessary and near the end to help out with the questions. But I'll be doing most of the presentation today. So this work is done together with the UCSF Long-Term Care Health Workforce Research Center. I'm over here at the University of Washington to work with them while I was at George Washington University. This project was funded by the Health Resources and Services Administration under a cooperative agreement through UCSF. This work has already been published online, and you can find it at UCSF's Health Workforce Research Center. You can both find a long report, of which we're showing some of our main findings here today, as well as a brief with some short snippets of highlighting our findings. So just a little bit of background before we start. Of course, many of you know that we have an aging baby boomer population. They're living longer and with more chronic disease. And so as a result, we think that long-term care will become more in demand over time. On top of that, we know that the Affordable Care Act passed in 2010 will also probably increase the demand for health care. However, the impact of the Affordable Care Act on long-term care services is a little bit up in the air and not so clear, especially given that the Affordable Care Act did not have very many specific measures regarding the long-term care services. And so as a result, the impact that the ACA might have on supply is also somewhat uncertain. However, we do know, based on various projections, that there's an expected job growth in the long-term care sector. The Bureau of Labor Statistics, for example, projects that the nursing facilities out there will probably see an increase in job growth by about 24%, and the home health care sector will probably see an increase in the available jobs by about 60%. And again, many of this job growth is projected to be driven by the aging baby boomer population living longer. So we know that there seems to be this potential opportunities for more jobs in this long-term care sector, especially at the entry level. However, we do know that there's a reportedly high rates of turnover and unemployment in the long-term care sector. So in this study, we wanted to take a deeper dive into what's happening as people are entering and exiting the long-term care sector. So the first set of questions are basically threefold. One is that we're trying to understand from where the long-term care sector draws its workers. In other words, from what other sectors are people entering from before they come into long-term care? And at what rate is that happening? Then on the other end, we're wondering, so once you're in long-term care and say you move on, where do they go to and at what rate is that happening? And we like to know what characteristics might be associated with these entrants and leavers. And so today we'll show you a variety of tables showing you some various demographic and socioeconomic characteristics associated with entrants and leavers, and comparing this to those who have been staying in the long-term care workforce over time. For this study, we draw from the Current Population Survey. This is a publicly available survey conducted by the Bureau of Labor Statistics. Specifically, we use what's called the Annual Social and Economic Supplement, otherwise known as the March Supplement. The CPS is collected on a monthly basis, so the March Supplement in particular provides much more detail about income and job tenure. And in particular, what this March Supplement asks is a set of questions about what job and sector someone works in the current year that the survey is being conducted, and then they ask what job and what industry they were working in the prior year. So this is one of the few surveys available where one can actually see a little bit of the job transition from year to year. And we draw 10 years of data from the CPS to get a little bit of sense of the trends over time. So this is an annual cross-sectional survey. There's approximately 100,000 household samples in CPS. This represents about 200,000, or this includes 200,000 individuals. There are survey weights to make this survey nationally representative. We focus on the civilian, non-institutionalized U.S. population, and we restrict the analysis to those who are 16 years or older, or basically eligible to work in the labor force. We focus on those who actually report being in the labor force either in the current or the prior year. And again, this is based on a question that, for example, someone is asked in 2013 about whether or not they're working in this year, and with a look-back period of 1 year. Okay, before we delve into how we went about, before we delve into our results, we have to do a little bit of definition. It was actually quite tricky to actually define the long-term care industry. We rely on codes that are provided through CPS. It's called the North American Industry Classification System, or the NAICS codes. And those who might be familiar with the NAICS codes, this is a fairly standardized and well-accepted way to classify different industries in the whole entire economy. And there's a subset of them that are specifically highlighted as being long-term care industries, and that would be nursing facilities, includes skilled nursing facilities, and residential care facilities without nursing. There's another category that we consider to be long-term care, which would be the home health care services. Under the NAICS classification system, this actually falls under the ambulatory care definition, but we thought that home health care services is very much a part of the long-term care industry, so we include this as part of our long-term care industry definition. We also know that long-term care does not always involve direct health care, but involves a lot of other social services. So we expanded our definition of the long-term care industry to include individual and family services, community food and housing, as well as housing and emergency services, as well as private households. So we recognize that the last three types of industries might not always involve healthcare per se, but we did feel that there was a sufficient number of workers in these different industries that warranted it to be included in our definition of the long-term care industry. And I just want to have a note about my terminology here. Industry and sector often tend to be used interchangeably in discussions, especially among labor economists. In this conversation, usually when I say long-term care industry, I'm trying to talk about the collective 6 long-term care sectors. And when I'm saying long-term care sector, I'm trying to highlight each one of these separate 6 NAICS categories listed above. So within the long-term care industry, there's a further classification of the jobs that people might take. And again, we use a classification system used by the Current Population Survey called the Standard Occupational Classification System, or the SOC codes. And in the SOC code system, we identified jobs that we knew were prevalent based on, which were prevalent jobs based on our knowledge of the long-term care industry. But we also chose several jobs that might not be very prevalent, but we know are very relevant. So here you see a list of about 9 occupations that we will be concentrating our work on. Now, some of the disaggregation in the occupations might not be fully satisfactory. For example, we have the nursing, psychiatric, and home health aide occupation, which combines basically 3 different kinds of aides. Unfortunately, we are not able to further disaggregate that job based on the coding system used in CPS. That is something that might potentially be worked on in the future by the occupational classification system folks who are behind that. So hopefully in the future revisions of the SOC codes, this will be further disaggregated. So let's define a little bit what transitions look like for us. So as I said, in CPS, they ask somebody when they're surveyed what their current year job and industry and occupation are. And then they ask, what did you do last year? So it's the same person that they're asking their current and prior year employment. And so when we talk about a transition here, when we're talking about stayers, we're talking about people who say that they worked in the same industry in the current and the prior year. And I'll talk a little bit about when I mean sector versus industry as we move on through the tables. But a stayer basically is saying that they're staying in the same field from year to year. An entrant is someone who, in the prior year, did not report any of those 6 long-term care sectors, but then in the current year, they said they worked in one of those 6 sectors. So they did not prior work in long-term care, but now they entered into long-term care in the current year. A leaver is somebody who said that in the prior year, they worked in one of the 6 long-term care sectors, but in the current year, they were not working anymore in one of those 6 long-term care sectors. So our definition of transition is really focused on moving in and out of the long-term care sectors and not really on moving in and out of the long-term care occupations. There's a lot of permutations here, so these were just some decisions we had to make. But we do talk about some of the changes in occupations later on in this in this seminar. So here, just delving right into our findings, I show the 6 different long-term care sectors. In our report, we show actually the top 5 occupations within each of these long-term care sectors, but here I'm just highlighting the top 2, which represents the majority of the jobs in each one of the sectors. And I apologize, I just noticed that the first column should be labeled sector, not occupation. But for example, we have the home health care services sector. And in this sector, you have over 1 million people who were employed in 2013. And about 40% of the workers in that sector are a nursing, psychiatric, and home health aide. Again, that's a category of jobs that we're not able to disaggregate further, but we do see that these probably most likely are home health aides. That's a large portion of our sector. In following, you have another 30% or so who are personal care aides in the home care healthcare sector. And when we looked actually across some of these, each one of these sectors, we saw that the top 5 jobs actually corresponded to about the majority, if not almost all, of the jobs in these sectors. So in home health care services, 5 jobs take up about 90% of all of the employees in that sector. And what you will see is that personal care aides is quite a common occupation across the different sectors, as well as the nursing, psychiatric, and home health aides. We actually don't see a high number of RNs or physicians in this sector, so we do realize that these lower skilled jobs play a very important role in the long-term care sector. Another thing to note is that among the most common jobs are often indirect care kind of workers. So you have building and ground cleaning and maintenance as a common job that appears. You have office and administrative support. residential care facilities, you see that food prep and service-related jobs are also very common. So when we think about long-term care, one has to realize that there's a lot of other types of workers that are involved in delivering services and play probably an important role. In this slide, we see that we look at the whole entire long-term care industry, so all 6 sectors together in 2013 to see which jobs are the most prevalent. So you see, again, that the personal and home care aides, which we call just personal care aides, are among the most common occupation in the long-term care sector, followed by nursing and psychiatric home health aides, followed by social workers, et cetera. Now, there might be some other occupations that might seem relevant. I noticed that someone mentioned that perhaps speech therapist might be an occupation that might be important, but we didn't see this as a highly prevalent occupation. Medical assistants also did not play a very large role among the occupations in the long-term care industry, even though we know that medical assistants do play a large role in the overall healthcare industry. In this figure, we see the entry rates versus exit rates, or sometimes, sorry, I will interchangeably say leavers and exit rates, but I mainly mean the same thing here. So the main thing to take away from this slide is that among the pool of people who say they worked in long-term care either last year or this year or both years, among that share, you see that those who are exiting is outpacing the share of those who are entering. So the remaining number of people that's not shown in here are those who are staying in the industry the whole way through. And so generally you do see that the exit rate is outpacing the entry rate, which is of concern in terms of thinking through the pipeline and whether or not we have a sufficient number of people available coming in. And so as a result of this high exit rate, this was concerning to us because we want to understand, well, why do we see such a high exit rate? And one thing to note here is that this data is actually pooled over a 10-year period, but we did look at this over time for each one of the sectors, and it remained fairly stable over the last 10 years, this exit and entry rates. If you look at it in aggregate, over the whole period, the long-term care entry rate, which fluctuates a bit but maintains relatively stable, was about 13% over this time period. The leaver rate was about 21%. Just to put that in comparison, when you look at the entire nation, the rate of change of jobs in the entire economy is about 16%. And one thing that we don't show here, but during the recession period, we did see the rate of movement between sectors to be amongst the lowest. So there wasn't much movement, in other words, during the recessionary period. So next I'm going to show a series of tables, and I realize this is a lot of numbers, so I'll try to highlight what some of the important findings are. So in the next 2 slides, I'm going to talk about the entrants, stayers, and leavers and their demographic characteristics across 6 of the sectors. So this is just the first 3 sectors. The next slide, I'll show the next 3 sectors. So one of the things to note is that this is a fairly female-dominated sector. You have up to 90% of our home health care services being a female. We do note that the entrants tend to be younger than our leavers. Our leavers also tend to be younger than the stayers. So what one might assume is that perhaps those who are leaving might be leaving because they might be close to retirement. However, we don't necessarily see that the leavers are older than those who have stayed between the 2 years. We don't see much racial diversity across those who are entering, leaving, or staying in these different sectors. However, I should note that the long-term care industry in general is a fairly diverse sector. Over 40% of our long-term care workers are minorities versus 20% of the rest of the population. We do see that the stayers tend to be more likely to be married, and they're a little bit less likely to have young children in the household. Just moving to the next slide, that just shows the other 3 sectors of the long-term care sector, but the trends tend to be about the same across all 6 sectors. In this next set of slides that we have, again, splitting up our sectors so that I show the first 3 here and then next 3 on the next slide. Here we show some of the socioeconomic characteristics associated with our entrants, stayers, and leavers. And what you see is that some things to note are that the rural residency is not actually very different across the different entrants, leavers, and stayers. At least we don't see a very strong, consistent trend. Citizenship does not seem to be a big factor, at least amongst these 3 sectors, but I'll show on the next slide it plays a little bit more of a role among those in the private household sector. We do see that work disability seems to play a fairly prominent role among those who are leavers. I highlighted this with some red boxes because this is where we just see a bit more of a difference. For example, in nursing care facilities, our leavers have an 8% of our leavers have some sort of work disability that they report versus only 2% of those who are staying or entering into nursing care facilities. And this is consistent actually across all 6 sectors. In terms of full-time versus part-time work, we do also note that our leavers tend to work, a higher share of them tend to be part-time workers. Another concerning aspect, too, is that our leavers, as well as our entrants, there's a higher share of them who are at or below the federal poverty level. The stayers tend to be doing better in terms of their wages and the poverty level compared to the entrants and leavers. So this raises some questions about those who are entering, whether they're actually staying or whether the entrants really are just cycling right back out again, and so they never really get to a point that there's some level of upward mobility. And that's an area for us to explore further. Just on the next slide, showing the next 3 sectors, again, you see similar trends where the citizenship status and the rural residency are not very varied across the different long-term care sectors. But again, note that the private household sector, you have a high share of those in the private household sector who are not a citizen. Again, work disability reports are fairly high amongst our leavers, and it, again, is a very consistent trend. In terms of full-time versus part-time work, generally the leavers tend to do more part-time work, especially amongst those who left out of the private household sector. Only 1/3 of them worked full-time. The other 2/3 were working part-time. Again, the poverty levels tend to be quite high for the entrants and leavers. So again, we're just trying to better understand, we would like to better understand what dynamic is happening here that the entrants and the leavers tend to be at such a high level of poverty. And in general, you see that their wages are actually quite low too. Now there's some trickiness around the definition of what earnings are here. The way the current population survey collects this information, the wages are based on their prior year occupation. So those who, say, entered into a long-term care sector, we don't know what their job is, what their wages are for the job in which they entered. We only know what their wages were at their prior job. Okay, the next slide here, we show all 6 sectors and show from what industry people are entering into each one of these sectors. And one thing to note really amongst the entry trends is that many of them came out of unemployment or they came out of the labor force. So NILF here stands for not in the labor force. Unfortunately, the way things are coded, we're not able to disaggregate whether or not someone came out of the labor force or whether or not they came out of being unemployed. but generally it was one of those two things. Another thing to note is that we have quite a few people coming from non-healthcare sectors coming into these long-term care sectors. So quite a few folks are coming from the leisure and hospitality sector, as well as the education sector. So when people are entering into these industries, we looked at what occupation they tend to take on. And amongst the most common jobs people are taking on are the nursing, psychiatric, and home health aides, as well as personal care aides. That's a fairly consistent one across the sectors. But we do see that a growing number of people are coming in to take on non-healthcare related jobs like the office and administrative support jobs. And this is fairly consistent with what we're seeing as the most common jobs. I think the most concerning element that we saw is that when people are leaving these six sectors, about half of these people leaving are leaving out of the workforce or they're becoming unemployed. And this is a little bit concerning given that we know that there's a high there's a high number of jobs available, but given some of the characteristics that we're seeing amongst our leavers, they might be leaving because maybe they're leaving disabled or they're leaving at a high level of poverty, meaning that they might not be paid enough. And so maybe these job opportunities are not particularly suitable for them. In this slide, we see what they go to. So these leavers, when they leave, there is some understanding of, this one's looking at, so why didn't somebody work in the prior year amongst those people who entered in? So unfortunately, we are not able to know why somebody left their job. And that's an area for more work to better understand why someone separated and either became unemployed and couldn't find a job or left out of the labor force altogether. So in this slide, we're seeing, well, why didn't somebody work last year prior to entering into long-term care? And you see that going to school is a very common reason why people weren't working last year. However, many folks, about a third of them, of our entrants, were taking care of somebody at home or in the family. There's also actually a high number of them who were already ill or disabled prior to entering into long-term care, which might explain some of the reasons why some of our leavers left at a high level of disability. Here we're shifting over to those who shift over to the long-term care occupations. And when we're talking about entry, staying, and leaving in this case, we mean, for example, a registered nurse who entered into one of the 6 long-term care sectors or left out of one of the 6 long-term care sectors or stayed in one of the 6 long-term care sectors. We did not look at these transitions so carefully by whether or not they changed their job along the way because, again, there's just so many permutations here. So some of the trends to highlight, again, is consistent with what we found before. This is a fairly female-dominated field. Many of the occupations that we saw had almost all of the workers being female. And again, I only show about 5 of the occupations here. On the next slide, I'll show the next 4 occupations. We looked at 9 occupations in total. We did tend to see that the entrants do tend to be younger. You can especially see that our medical assistants and the personal care aides, there's a high share of them who are between the ages of 16 to 24. There isn't much differences in the diversity across the entrants, leavers, and stayers. Those who tend to stay tend to be more likely to be married, and they tend to have, they were less likely to have young children in the household. In this slide, I just showed the other 4 out of the 9 jobs that we looked at. Again, the trends tended to be relatively consistent. So again, we looked at the socioeconomic characteristics of each of these occupations, of the entrants, leavers, and stayers. We tend to see that our entrants have it's really job dependent, in which you see the citizenship differences. You see that among registered nurses, there's a higher share of the entrants who are not a citizen, but that's not necessarily true when you look across all the occupations, like medical assistants. A smaller share of them are not a U.S. citizen. Rural residency does not vary very much by occupation. But again, like we saw when we looked in aggregate at each of the sectors, the work disability tended to be fairly high among those people who were leaving. So this basically notes that it's not just one occupation that seems to be hurting the most when they're leaving the long-term care sector. It seems to be distributed very consistently. It's a consistent trend across the occupations. We do note that the long-term care workers here, the ones who are leaving, tend to be more likely to be a part-time worker rather than a full-time worker. We also see a fairly consistent trend that our leavers are leaving at a fairly high level of poverty and with relatively low wages. In particular, to note are our medical assistants. Even though they're not a very prevalent occupation in the long-term care industry, about a quarter of the people, of the medical assistants leaving long-term care are at or below the poverty level. Another thing to note is the personal and home care aides, to about a quarter of our entrants as well as our leavers are also at or below the poverty level. And the trends stay, again, fairly consistent across all 9 occupations. We didn't see as prominent of the issue of work disability amongst our social and community services managers or our social workers, and that might be more of a reflection of the type of work that they're involved in these settings. So here, it gets a little complicated. We have 5 of the 9 jobs shown here, and we see in the first 2 columns that those entering into the long-term care sector, and when I say entrant, I mean entering into any one of the 6 long-term care sectors described earlier. That's what the star actually indicates, and I apologize if there isn't something that that star goes to here. But generally, the entrant rate is less than the leaver rate across all of the occupations. So when a registered nurse entered one of the 6 long-term care sectors, we found that about half of them were coming from hospitals. And so hospitals is a common feeder across, is a common source from where these long-term care workers are coming from. But again, across the occupations, many of them are coming from out of the labor force or they were unemployed in the prior year. Again, those who were out of the labor force, it could be related to going to school, which I'll show a little bit later. When we looked at those entrants, we wanted to know to where did they go to in the long-term care sector. So many of those of registered nurses, for example, or LPNs, LVNs, when they're entering into the long-term care sector, a majority of these folks are entering into the nursing care facilities, followed by home health care services. And then when we look at where they go afterwards, so those who leave the long-term care sector, again, we see hospitals as a potential area where people are cycling in and out of, but we see a high number of them leaving out of the labor force or they're becoming unemployed. And that's a consistent trend, especially amongst our lower skilled workers. In this next slide, we show, again, the remaining 4 jobs here as the 9. And again, you see that the long-term care leaver rate is higher than the entry rate, mostly except for the physical therapist. And the prior area where people were working before coming into long-term care, hospitals is a common source for physical therapists to come from. Many are coming from out of the labor force or coming from a non-healthcare specific place, such as leisure and hospitality or education. When people are entering into the long-term care industry, for this set of workers, we see that the individual and family services sector seems to be a common place where these folks are going to. But residential care facilities is also a common place where people enter into. But similar to the last slide, we see that a high share of those who are leaving the long-term care sector are leaving unemployed or they're leaving out of the workforce altogether. The physical therapist is really one of the few occupations here that is leaving to another healthcare sector, or where that's the more dominant place where people leave to. All right, So here we're showing the occupational trends amongst those amongst these 9 jobs to show the rate at which they're changing their occupation. As I mentioned earlier, we didn't make this a big focus of our study because of all the permutations, but we did think it was important to show how people were changing their jobs as they were changing industries. And we do see that amongst those people who are entering into the long-term care sector, into one of those 6 long-term care sectors, the rate of change for their job, the fact that they might not have been the same occupation across as they changed industries, is higher amongst those who tended to be in a lower skilled job. So personal and home care aides, for example, almost all of them held some sort of other occupation prior to entering into the long-term care sector. On the other hand, registered nurses, only a quarter of them had some other job prior to entering into long-term care. And when people left the long-term care sector, the rate of change in terms of their occupation was much lower. Amongst those people who stayed in the long-term care sector between the last year and the current year, there wasn't much change in their occupations from year to year. But when they're leaving the long-term care sector, you do see that there's a high rate of occupation change. So amongst those people who are entering into the long-term care sector, we looked at what job they had. So we know that jobs changed. But again, the jobs, it gets a little tricky because many of them came from out of the labor force, so they were not working in the prior year. So they might have been a student or taking care of family members. But what we're mostly trying to see here is if there might be some potential career ladder. We didn't see a very strong one here, but you do see, for example, the medical assistants, for example, prior they were working in food preparation and services, or the nursing, psychiatric, and home health aides, they were prior working as medical assistants. Then the last column is consistent with what we saw before, which is many who are leaving out of the long-term care sector, they're just leaving unemployed or out of the workforce. We see a little bit of career laddering where you might see the physical therapist moving into an occupational therapist job. There seems to be some lateral movement among the social and community service workers where they're moving into another management occupation. So this is similar to a slide I showed earlier, but looking at each of the long-term care occupations to see what were folks doing in the last year when they said they were out of the labor force or not working. And we see a large number of them. The dark blue bars here are showing that many of them were in school. Also, a large number of them were taking care of their home or their family members. But there's a significant number here, especially among social workers and personal care aides and LPNs and LVNs who were ill or disabled prior to entering. Another notable trend is that the RNs and the miscellaneous sets of community and social service specialists came out of retirement. So I showed a large number of slides here, but hopefully you at least saw some common trends along the way. But there are some limitations to note. This is a national survey, and it was not designed specifically to study the long-term care sector. These are also self-report data. So people are self-identifying what jobs and what industries and occupations that they work in. Now, it's not as simple as them just saying, I work in the residential facility. They have to do some description of the type of environment in which they work, in which case the current population survey folks actually code it into these different categories. We also are not able to look at the unpaid or informal caregiver population, which we know plays a large role in long-term care. And it's really unknown to us why people are leaving, entering, or staying in their jobs. I mean, we have some sense of what they were doing in their prior year, prior to entering into long-term care, if they were out of the labor force. But we really don't know if people are leaving voluntarily or not. Also, our wages are not quite reflective of what the long-term care job might be paying, so there's some challenges in looking at that. So at the end of the day, what we seem to be able to take away from this study is that many of the long-term care jobs are not always direct care jobs. We do see a high number of folks who are working in food preparation services, office and admin jobs, and that does play a large role in our long-term care sector. We do see that the long-term care sector does employ a high share of low-skilled workers. Hospitals tend to be a very common industry from which people are moving in and out of, but there's a lot of other non-health industries that seem to be, or there's a couple other non-health industries that are also playing a relevant role for feeding in our long-term care workers, such as leisure and hospitality. And I think what's most concerning to us is that the exit rate out of long-term care industries is outpacing entry rate. While it's not unknown necessarily that the turnover rate tends to be high among long-term care industries, and this is just one of the few studies that really documents this at a national level, and that the trends are fairly persistent over time. And that we see that when people are leaving, they're not necessarily leaving for a better career per se. It seems like many are leaving unemployed or out of the labor force altogether, and it's concerning when we know that there are many job opportunities. And when you look at the state of those who are leaving, it does seem like age and disability and poor health and earnings might be potentially important drivers here for us to explore further. We know that there are training programs that could be put into place into these different environments to help reduce turnover and that can improve the health and safety of people working. And the Affordable Care Act does have some training directed towards workers that might be working in long-term care industries. So maybe that will help a bit here. But we know there's a growing demand or an expected growing demand for more workers in long-term care. So more exploration needs to be done to look at people leaving out of the labor force, leaving out of long-term care, and to understand better why that happens. So that comes to the end of my part of the presentation here. If you have any other questions, I'm happy to take them right now or be followed up later by email. Joanne is also available here today as well as by email, and you can also download this report in full online. So thank you so much. I'll take any questions.
Thank you, Bianca. That was a wonderful presentation. At this point in time, we'll begin the Q&A session. Once more, you may ask questions using the chat panel on your screen. And please make sure you direct all your questions to all panelists to ensure that they have an opportunity to be answered. First question, and maybe you could elaborate on this. How has the Affordable Care Act impacted the exit and entry trends?
When we looked at the year-by-year trends in entry and exit, and we did this by each of the sectors as well as in aggregate, generally the movement rate into and out of long-term care was at its lowest point. It wasn't a huge change, but people just tend to stay more commonly across the 3 years of the recessionary period between 2007 and 2009. So we didn't see great movement, but that's fairly common across all healthcare industries, that during the recessionary period, people really tend to stay in their jobs.
Thank you. And really kind of a follow-up question, did the recession affect turnover?
It really, it doesn't seem to be an effect here. If anything, if you look at some of those trends, or if you look at the slide that we have where we asked what did you do in the prior year if you were not working, there were a few people who came out of retirement. Now that's a possible effect of the recession period where people were entering into these long-term care jobs as a way to maintain their salaries. At least that's one potential area that we can see the recessionary impact. Joanne, I don't know if you have anything else you'd like to add to that.
Yeah, there were some changes over time, including the retirement piece that you identified, which was not a huge effect, but is consistent with some of the anecdotes that we've heard. Looking over time, I know that we did look at some of these occupation trends over time, and there was a little bit more leaving after about 2010 than there had been during the, say, 2007 to 2010 period. Maybe that means there was a bit more people who stayed in their jobs and then they left their jobs. But these were relatively small changes, which I think are all within the margin of error of this survey.
Thank you. Next question. Is there any way to get at transitions in turnover between long-term care jobs, occupations? That is, does the CPS ask if a person's job is the same as the last year?
Yes, they do. We could definitely look at that. And to some degree, we did look at that in here where we looked at how the jobs changed relative to the movement in, separate from the movement in long-term care industries. A couple slides prior, I showed that at least those people who stayed in long-term care industries from year to year, they did not change their jobs very often. They mostly stayed in the same one. So we could take a deeper dive to see what jobs were changing. It's just at some point in time we get a little bit into a small numbers problem. Where one can take that deeper dive is to say in that prior year, what was their job prior to entering into long-term care, and we showed a little bit of that, but such a large number of people were coming out of the labor force or they were entering back into the labor force, so they were out of the labor force prior. So again, we didn't see a large movement by where there was a particular job in which people were moving from into long-term care. But we looked at it in many different ways, and it just gets a little bit complicated. So we really tried to focus on a select number of jobs and see just whether or not how they really moved in and out of the sectors. But yes, technically it is possible to do more of a deeper dive.
Thank you. Next question. How does the calculation of entrants, stayers, and leavers capture the fact that workers can in and out a lot in the same year and at any time of year?
Yeah, that's a tricky one. Now, unfortunately, this survey does not, while it is a month-to-month type of a survey, and the sampling is quite complex, so the current population survey where people are cycled in and out for 4-month periods, they really only have this moment in time kind of capture where they ask, what do you do this year, what did you do last year, kind of a question, and they don't ask anything about what happened in between, and there isn't month-to-month follow-up on that particular question of what was their industry and job. And I don't know of any other national survey like this that can get to that. One would have to really have a more focused approach to look at the occupation to follow changes over time.
Yeah, I think the one data source that we've heard of where you might be able to do that is, I believe that the Census Bureau has a data set that compiles payroll tax data from states.
Yeah.
And those data, you have to become a sworn officer of the census, and you have to analyze the data in their facility. It's not for every state, but you could identify people who are in the long-term care industry and then track them over time, I think, on a month-to-month or quarterly basis. You wouldn't know what occupations they were in, from what I understand of the data, or at least you wouldn't know for many of the states what their occupations were. You would just know what industry they were in.
Thank you. What's the percentage of nursing and psychiatric aides that are certified nurse assistants? Because they make up so much of the nursing home workforce.
So you're saying that they might be a CNA by training, but they're in this occupation of nursing and psychiatric aides?
Yeah, I think that the occupational classifications here unfortunately don't enable you to identify who is certified and who is not. I don't know that there's any product of the Bureau of Labor Statistics that would enable you to separate out the certified nursing assistants from this broader category. I think you would have to try to go to state-level data to try to get some estimates of that.
Yeah, I'm sure that CPS would not be able to capture the certifications relative to the occupations. I think people, when they describe their occupation, they are asked to describe their occupation a bit, and then it is a bit of a judgment by CPS about how they end up classifying them. So unless they call themselves a CNA, I think otherwise it would be, they would only really be classified based on how they describe themselves. So unless they say that they're CNAs, they won't otherwise be classified as that.
Yeah, I don't believe that they they put certified nursing assistants in that general category, and so they don't, it's considered a subset, and they don't distinguish in the Bureau of Labor Statistics data. We have a similar problem with clinical nurse specialists are not distinguished from registered nurses in the data. And certainly I can understand when the Bureau of Labor Statistics is trying to track thousands of occupations that there's a limit to what they could do, but it would be nice if we could see if there are differences between certified and uncertified aides.
Thank you. Okay, here's another question. More of the workforce comes from the urban residencies. Any idea why there's a small amount from the rural ones? How was rural residents defined? Is it possible to look at the differences in working in rural versus urban settings?
Yes, one could take a deeper look at the rural versus urban. The way this is classified is based on census areas, so CBSAs, and it's based on what's considered a metro area, kind of slightly less metro area, and a non-metro area. So that you can't get into things such as looking at like RUCA codes or much more smaller levels of rurality. But we didn't take a very deep dive look at it in this round, so unfortunately I don't have much to comment on that other than one can at least look maybe a little bit more at the urban-rural movements and try to get a sense of who might be one can only look at the snapshots really actually between rural and urban. One cannot really identify whether or not they worked in a rural area in one year, an urban area in another year.
Thank you. Next question. Is it possible to do a state or regional analysis? Will there be regional differences, do you think?
Well, CPS is really designed for a national focus. One could potentially do state level analysis. I think when you start disaggregating it more, I get a little concerned about some small numbers issues. I mean, one can look at the American Community Survey as an alternative source to look at more geographic variations, but unfortunately with the American Community Survey, which follows a very similar format as the Current Population Survey, unfortunately the ACS does not ask that job transition variable. So one could potentially do state-level analysis, but much more than that, I think that would be a bit of a challenge.
I think at the state level, you'd probably be limited to looking at the larger states. The smaller states probably don't have enough sample size to really be able to measure any patterns with any precision.
Thank you. Here's another question. Why is the exit rate turnover so high? What kinds of things may be worth trying to reduce turnover?
Joanne, do you have some specific examples that you can think of?
Oh, wow. Well, there is some literature surrounding the factors that affect turnover. Why the turnover is so high. I think some of the data that we have suggests some of the answers to that. A lot of these jobs are entry-level jobs that don't pay well and that people can work full-time in these positions and still be in poverty. So I think people leave these jobs often because they're looking for a better wage or a better career opportunity. We saw very little evidence of career ladders. So from a retention and policy standpoint, trying to identify ways that these jobs can be made more attractive, that there is a pathway for career improvement for people who want to stay in the occupation, who really like the work and want to develop their skills more deeply without necessarily going back for another licensure or a different credential. So how can you build those kinds of jobs and how can you create opportunities for growth within these occupations? The nursing, psychiatric, and home health aid and the which is a broad category, and then also the personal and home care aid occupations are among the largest healthcare occupations in the United States. They are bigger than registered nursing, they're bigger than physicians. And, these are minimum wage jobs. So without trying to figure out how to build those into career pathways, I think they may be doomed, sadly, to having a high rate of turnover as many entry-level types of jobs do.
Yeah, I think some of what we were hoping to bring attention to in this study is just really characterizing who our leavers are in a way that just hasn't really been as specific before, where it's bringing attention to the fact that there's lots of very entry-level workers. People are maybe even being encouraged into these healthcare jobs as a potential career path, given that Bureau of Labor Statistics does project large growth in the future for these jobs in terms of its demand. But I guess to some degree we're putting out there a cautionary note that we don't necessarily see that this is a stepping stone to something more. And talking to different providers, they are concerned about their lower-level support staff and less educated support staff to figure out how they can retain them, and because they do know that turnover is a concern for their quality of care, and there's some evidence that turnover does impact quality of care. So to the extent that we can show what some of the factors are related to the leaving of these jobs, like wages, we at least hope to bring those facts to the table.
Hey, thank you, Bianca. I believe, let's try and squeeze in one more question and then we'll call it good for the webinar. What recommendations would you make to the BLS in order to make the data even more useful? For example, should they disaggregate certain occupational titles? A bit of a big one there.
Well, I know that there has been a recent call for new occupation titles for the revision of the standard occupational classification system. So the SOC codes will be updated over time, and I know there has been some recommendations put forth to disaggregate the nursing, psychiatric, and home health aides. In terms of the current population survey, it would be great if they did maybe a 6-month lag rather than a 1-year lag in terms of asking about job transitions, at least as a start, just to add that question one more time somewhere in their monthly data collection system. Joanne, do you have any other recommendations?
No, not at this time. I think Bureau of Labor Statistics really does struggle with trying to cover the entire U.S. economy. So, but hopefully some of the revisions that might come in the occupational classifications will help.
Actually, may I put out one more recommendation too, which is the wages part is something that I know for me personally, I find it very interesting to look at some of those trends, but it's a little challenging when the question about wages is based on the prior year job. Now, understandably, a current year hasn't completed yet, so one can maybe not report accurately what their current wages are, what their current annual wages are, but maybe there could be more done to better link how the jobs asked about relate to the wages.
Okay, thank you, Bianca, and thank you, Joanne. I thought that was a wonderful presentation. And thank you out there for attending our webinar. Just to let you know, we will be posting our slides shortly to our website. So if you want to download them, check back very quickly at healthworkforceta.org. We hope to see you again in the future. Thank you, and have a good day.